Hey guys, I hope you're all doing well. Today we are going to have another topic. It's going to be osteoporosis today. So we're going to be talking about some of the risk factors with osteoporosis, how you can get yourself tested to see if you are experiencing some of these problems that osteoporosis can cause, and we're going to be talking about some treatment. So this topic's a little bit more near and dear to me. Osteoporosis does run quite a bit in my family, especially the women in my family. A lot of them have this. So some of the risk factors with osteoporosis is being female, having a smaller bone stature, so being a little bit more slender. Asian and Caucasian women are at higher risk of getting this problem. Another risk factor that you can control is diet. So not getting enough calcium and vitamin D in your diet. You know, if you were in your a little bit younger years, so less than 50 years old, and you've had some fractures in your life, that can put you at more risk of getting osteoporosis. What we do notice with people with osteoporosis, as this condition progresses, it can cause postural progression. So it can cause a little bit more forward stooping of the posture, especially when it gets more advanced. So what osteoporosis is weakening of the bones, okay? So what happens is your body starts stripping away from the bone at a rate that's faster than what your body can replace it at. And what we do see is that studying the bone under a microscope, the bones kind of look like a honeycomb. And normally what bones should look like under a microscope is holes that are kind of smaller, okay? But with osteoporosis, under a microscope studying a bone, you see these gaping holes that are a lot bigger, okay? And that's weakening of the bone. So obviously the biggest problem with osteoporosis is risk for fractures. So the most common sites for fractures are in the spine, the hip, and actually sometimes the wrist. One misconception of this disease is that it only happens in women and it only happens in the older population. Well, actually what we find is this also is happening in men, but just at a lower percentage. And actually we are also finding that there are younger people that do have osteoporosis too. So it's not only an older population issue, although it's much more common in people that are older, especially over the age of 60. So it's very, very important to get tested for this, especially if you know that you're a risk factor of this, if you have family members that have had this before, or if you're especially if you're a Caucasian or Asian woman after menopause, those types of things. And the way you get tested is through a bone density scan, okay? And what this is you'd be lying on an x-ray table, a flat x-ray table, and you would have a scanning arm just kind of running over your body, especially in that area where you have more concern, like your hips or your spine. So you don't have to go in like a tunnel, or you don't have to get an injection or anything like that. It's a nice, easy test. And they recommend that you get this test about every 2 to 5 years. So now after you get this test done, you're gonna get a score. And what the score is called, it's called a T-score. And I got a nice illustration to show this to you guys. A good healthy T-score would be anything less than -1, okay? So, it goes from -1 to 3, and that's indicating that you do not have osteoporosis. Now, if you get a score between -1 and 2.5, that's indicating that you have osteopenia, which is a precursor of osteoporosis. So that's showing that you are starting to have the initial signs of osteoporosis, and this is a good time for you to really start getting on some sort of medication to help to strengthen your bone, to start doing some weight-bearing exercises, to start taking control of your diet, anything that you can do to really prevent this progression. And then anything less than -2.5 or less, that's showing that you are in that range of osteoporosis. There actually are people that, they have the osteopenia, or they're in that osteoporosis category. And with the help of exercise and medications, they can actually reverse that. A lot of them are able to go from osteoporosis to being osteopenia, which is that precursor. Or they can get from that category of osteopenia to actually being within that normal T-score range. All right, so like I mentioned before, the most common result of having osteoporosis, or consequence I should say, is a compression fracture. Compression fractures happen most frequently at the middle part of the spine. And I'll show you a picture of what a compression fracture looks like. So these compression fractures, they happen at the part of the vertebrae called the vertebral body. And most commonly, they occur at the front part of the vertebral body. And what that does is that creates like a wedge-shaped figure in the vertebrae because the anterior part of the vertebrae becomes more narrow from the fracture, while the posterior part of the back of the vertebrae retains its normal height. So they call this a wedge fracture or a compression wedge fracture. Now the scary thing about these fractures is a lot of times they're what's called silent fractures. So that means that these individuals, they may have these fractures and they don't realize it because a lot of times they don't have symptoms right away. They may not notice the symptoms until maybe weeks later, months later, or sometimes, greater than 6 months later. Now, if they're mild enough, what happens is your physician will most likely prescribe you with wearing a brace to stabilize it. And usually they recommend that they wear the brace for about 2 to 3 months for it to heal. Now, if it's not a stable fracture and it's greater than a mild fracture, sometimes what they need to do is called a vertebroplasty or kyphoplasty, where they actually go in and infuse that segment where that vertebrae has got a fracture with cement. Okay, and a lot of times that'll really fix a lot of those painful symptoms. The most important thing for people with osteoporosis to do to prevent these fractures and to prevent the weakening of these bones is to do weight-bearing exercises. So weight-bearing is meaning anything where you're upright on your feet. So walking is a great exercise. Walking is probably one of the best things you can do to keep your bones strong. Another thing that's important to remember is that this osteoporosis, as it progresses, it can be a really big hindrance on your posture. So it can cause that forward stooping posture that you may see in some people. So making sure that you're cognizant of maintaining really good posture, maintaining that upright posture is really, really important, because if you are one of those people that are susceptible to slouching a lot, as those bones weaken, it's just going to be configured into that posture that you're demanding on your body. Next, I'm going to show you guys several exercises that are weight-bearing in nature that would be great for keeping your bones nice and healthy and strong and to help to minimize the progression of osteoporosis. Okay, so as I mentioned earlier, walking is the best exercise you can do for osteoporosis. The important thing though is to do this pain-free. So if you do have a compression fracture and even while you're wearing your brace, you're getting symptoms, you may need something like a cane or a walker to walk. And even if you need those assistive devices, it's better to continue walking than not, as long as those devices help you to accomplish that pain-free. Another thing too is when you're walking, you want to make sure that you're able to maintain your balance. So obviously, if you feel uncomfortable or not confident walking on uneven surfaces, such as on the beach with sand or over grass, if you do have osteoporosis, you want to make sure that safety is your #1 priority. Anything or any environment that puts you at risk for falling, I'd rather you still be safe, so maybe continue walking on an even surface or with an assistive device to help you keep your balance. Another really great exercise is squats. Here I got a physio ball behind me to kind of give my back some support, and it kind of helps to assist the squat. And basically all you do is you can just do a mini squat and come back up, okay? And what this does is loads your legs, it helps to load your spine to really develop that bony remodeling. And what I would recommend is either 3 sets of 10, or if you feel like you can, about 30 repetitions. What I don't want you guys to do though is to go really, really deep in the squat, because then for one, that can put a lot of stress on those vertebral bodies to cause a compression fracture. And 2, it's kind of really hard to come back up. So it's better actually if you just do a mini squat to start with, okay? The next exercise I'm going to show you guys is lunges. With this, you would just take a moderate size step and you just come straight down, okay? And I like to alternate with this one. So you can kind of alternate the legs. Common mistake some people do with this exercise is they'll lunge, they do a good job with coming down, but then they bend forward. With osteoporosis, you definitely don't want to do that, because like I said, that puts you at risk for causing a compression fracture. So the better thing is to keep that nice straight posture and then come down. Another thing too is I don't want you guys taking a really big step and doing it. Start off with taking a moderate size step and coming straight down, keeping your stomach muscles tight. The next exercise is step ups. So you just literally, it's easy enough. You just step up, step down. You can bring both feet on the step, Or if you want, you can just do one leg at a time. Okay? This one I would recommend again 3 sets of 10, or you can do 30 at a time. Make sure that the step that you are using is fixated to the ground, that it's not going to slide or slip on you. Another thing too is if you're new to this exercise, make sure there's something supportive that you can hold on to for your balance, okay? Also make sure that you're maintaining erect posture while you're doing this exercise. Again, I don't want you leaning forward. Try to keep your stomach muscles tight and stand tall. Okay, the next exercise I'm going to show you guys is called lateral stepping or even lateral lunging. With this, you're going to need some therotubing. So basically what you do is you step on the tube, and I'm giving myself resistance by pulling up with my arms, keeping my arms close to my chest here so I'm not having a lot of strain on my shoulders. And I'm just taking lateral steps, keeping my spine nice and tall, keeping my stomach muscles tight. Another thing you can do with this therotubing is you can actually do squats with it too. The therotube gives you a little bit of resistance with coming back up. And if you want, you can even incorporate shoulder press up too. With the lateral steps, I would just kind of go back and forth across the room maybe several times. Okay, the last exercise I'm going to show you guys is wall push-ups. This is really good for putting weight-bearing stress through your arms and your spine. You just kind of get maybe 5 feet away from the wall. You lean into the wall, bending your elbows, and come back up. 3 sets of 10, or if you feel comfortable, you can do 30 repetitions at a time. Alright guys, that's it for this osteoporosis video. If you have any questions, again, give us a call. You can leave comments on Facebook or Instagram. We're going to leave those links for you on this page. Look for us again next week. We'll be having another video. Thanks guys.